If you're a woman dealing with hair thinning, I want you to hear this first. You are not alone, and you are not doing something wrong. Hair is tied to identity, femininity, confidence, and even the way we feel loved and seen. So when your ponytail feels smaller, your part looks wider, or you start noticing more hair in the shower, it can feel like a quiet panic that no one else understands. Today, we're going to pull the fear out of this situation and replace it with clarity. You're going to learn the real root causes of hair thinning in women, how to tell which kind you might be dealing with, what fixes actually help, what's hype, and when it's time to involve a professional. This is general education, not personal medical advice. But by the end of this video, you'll feel grounded, informed, and hopeful because hair thinning is often treatable, and even when it isn't fully reversible, it's absolutely manageable. Let's get into it. What normal shedding looks like. Let me start with a quick reality check. Every woman sheds hair daily. That's part of the hair cycle. A healthy scalp is constantly losing old hairs and growing new ones. So the question isn't, am I shedding? The question is, am I shedding more than usual or seeing less regrowth? Here are a few signs thinning might be happening. Your ponytail circumference is shrinking. Your part is widening, especially toward the crown. Your hairline looks thinner around the temples. You see more scalp under bright light or in photos. You're shedding for months, and it's not slowing down. Now, it's also important to separate thinning from breakage. Breakage looks like shorter, snapped hairs, often from heat, tight styles, harsh chemicals, or dry, brittle strands. Thinning is when fewer hairs are growing overall, or the hairs are growing finer and smaller. They can happen together, but the fixes are a bit different. And that leads us to the next piece, understanding why hair thins. The hair cycle in plain English. Hair grows in a loop. Think of it like seasons. Growth phase, hair is actively growing. This phase lasts years. Resting phase, hair pauses. Shedding phase, hair releases so a new one can replace it. Most of your hair should be in the growth phase at any time. Hair thinning happens when too many hairs shift into shedding at once, or the growth phase gets shorter, or follicles shrink and produce thinner strands. That's the foundation. Now let's talk about the big root causes. I want you to think of hair thinning causes like 6 major buckets. We'll go through each in a practical way. Bucket 1, stress shedding, telogen effluvium. This is one of the most common causes. It happens when your body goes through a shock and says, non-essential functions pause. Hair growth gets paused. Triggers include major emotional stress illness or high fever surgery, childbirth, sudden weight loss, a big life disruption stopping, or starting certain medications, even a rough season of poor sleep. The key clue here. The shedding usually starts 2 to 3 months after the trigger. So women often say, nothing happened recently, but the scalp is responding to something from weeks or months ago. The good news, stress shedding is usually temporary. Once the trigger is addressed, growth comes back. But it takes time. Bucket 2, female pattern hair loss, genetic/hormonal thinning. This is gradual thinning over the top of the head and crown, often with a widening part. It's influenced by genetics, aging, and sensitivity to androgens, hormones like testosterone, which women also have in small amounts. Even if your hormone levels are normal, your follicles might be sensitive to them. Clues: slow, steady thinning over years, widening part, more scalp showing at crown. Family history of thinning hair. This one is not just a wait and see. Early action matters because follicles can miniaturize over time. Bucket 3, hormone shifts and life stages. Women's hormones change more than men's, so our hair responds. Common stages: postpartum period, perimenopause, and menopause, coming off birth, control thyroid imbalances. Pros: polycystic ovarian syndrome. Clues you might be in this bucket. Thinning plus irregular periods, acne flare-ups, increased facial hair, sudden changes after pregnancy or contraceptive shifts, hot flashes, or menopausal symptoms. The hair follicles are basically reading your internal environment. Bucket 4, nutritional gaps. Hair is not essential for survival. So if the body is low on fuel or key building blocks, hair growth is one of the first things to downshift. Common culprits: low iron or anemia, low protein intake, low vitamin D, B12, or folate deficiency, very restrictive dieting, rapid weight loss. including from new weight loss medications. Clue: you may notice diffuse thinning all over, not just the crown. Important note: more supplements is not always better. The goal is fixing what's missing, not guessing. Bucket 5. Damage and traction. This one is huge, especially for women who style frequently. Traction alopecia is thinning caused by repeated pulling. Triggers: tight braids, heavy extensions, constant ponytails, or buns, glued wigs, without breaks, aggressive brushing, harsh relaxers, or bleach. Clues: thinning around hairline or temples, broken short hairs near edges, tenderness in the scalp, thinning where styles pull most if caught early. This is often reversible. If ignored for years, follicles can scar and thinning can become permanent. Bucket 6. Autoimmune or scalp conditions. This bucket needs professional attention. Examples: alopecia areata, patchy loss; scarring alopecias, severe dandruff or psoriasis that inflames follicles. Clues: bald patches, burning, itching, pain, redness, scaling, or sores, sudden loss in chunks, eyebrow or lash thinning. Too, if you see these, don't wait it out. You want a dermatologist involved early. How to self-check your pattern. Here's a simple at-home way to think through it. Is the shedding sudden and heavy? Think stress shedding, illness, weight loss, meds. Is it slowly getting thinner at the crown or part? Think female pattern hair loss. Is it mainly the edges or where styles pull? Think traction and damage. Do you have patches or scalp symptoms? Think autoimmune or scalp disease. Take photos in the same lighting every month. You'll spot patterns more clearly than you will day-to-day in the mirror. What actually helps? The fixes ladder. Let's talk solutions in the right order. Start from the foundation and work upward. Step 1. Fix the environment. This means reduce stress when possible, normalize sleep, eat enough protein, avoid crash diets, treat any obvious scalp inflammation, loosen up styles that pull. Even the best treatment struggles in a hostile environment. Step 2. Gentle scalp and hair care. Simple things that help. Wash your scalp regularly if you're oily or flaky. Don't suffocate the scalp with endless buildup. Avoid daily heat. Detangle gently. Don't over-tighten. Protective styles. Rotate hairstyles so the same area isn't stressed. Healthy scalp, healthier growth. Step 3. Topical minoxidil, OTC. This is one of the most proven first-line treatments for female pattern thinning. Key expectations: you apply it consistently to the scalp. You may shed a bit more in the first weeks. That's a reset, not failure. Visible improvement usually takes 4 to 6 months. The best results often show around the 1-year mark. You need to keep using it to maintain gains. Not everyone needs it, but for gradual crown thinning, it's one of the most reliable tools. Step 4. Doctor-guided options. If the cause is hormonal or genetic, a doctor may discuss. Anti-androgen medications, low-dose oral minoxidil, certain hormone balancing strategies, addressing thyroid or iron issues, treating scalp autoimmune conditions early. This is where a professional can personalize what fits your body and history. Step 5. Procedures and devices some women benefit from. PRP, platelet-rich plasma, low-level laser therapy, microneedling, and skilled hands. Prescription topicals, targeted scalp treatments. These aren't magic, but they can meaningfully boost regrowth when used correctly. Step 6. Cosmetic support while healing. Let's be real. You want to feel good now, not only in 6 months. Helpful options: volumize and cuts, strategic parting, hair fibers, wigs, or toppers, lighter extensions that don't pull scalp. Concealers. There is zero shame in using support while your follicles recover. Timeline and mindset. Hair growth is slow. It's not like skin that can glow in 2 weeks with a good routine. A healthy hair change usually looks like less shedding in 2 to 3 months, baby hairs, and thicker feel in 4 to 6 months, clearer density in 9 to 12 months. So don't quit early. Most women stop right before the results would have started. And please ignore miracle products that promise full regrowth in 10 days. Hair does not work that way. When to see a professional? You should consider seeing a dermatologist if shedding is sudden and extreme, you have bald patches, your scalp itches, burns, hurts, or looks inflamed, thinning is progressing fast, you're losing brows or lashes too. You've tried basics for 6 months with no improvement. You're not overreacting. You're being wise. Let's wrap it up. Hair thinning in women usually comes from stress shedding, genetic pattern thinning, hormone shifts, nutritional gaps, traction, and damage, autoimmune, or scalp conditions. The fix is not one trick. It's a ladder: foundation, gentle care, proven treatments, and professional support when needed. If your hair is thinning right now, I want you to leave this video with hope. Your scalp is not betraying you. It's communicating something. And once you listen properly, you can respond in a way that helps. If this helped you, share it with a woman you care about. And in the comments, tell me, when did you first notice thinning? And what do you think your biggest cause bucket might be? I'll see you in the next one.